So we know that a CT angiogram in most cases can show that individual what is going on with the arteries around their heart. And we've spoken previously that narrowings in these hearts can lead to angina, and that blockages all of a sudden can lead to heart attack.
Including doctors, and I find that a little bit worrying. The reason is, if you go into a scanner and what you want is average health, and you come out of the scanner and you've got a result which is kind of the average, right? So if you're in your 60s and you're a man, the average is that you should have some thickening around the arteries. If you're a 25-year-old woman, you should have no thickening around the arteries.
So it sounds like it's the management before and after the scan, and not just thinking about the CT scanner as an intervention in itself, right?
Yeah, and it adds to anxiety, it adds to worry, it may lead to inappropriate medication changes, and that's why I worry about the proliferation of these studies, even though they are extremely valuable tools.
Yeah. Welcome to Delhi Belly, a series of conversations around preventative health for people of South Asian origin. And this is the next step in our series of debates, where again, we're going to be talking about topics in the grey zone where the evidence is pro and con. And so today I'm going to be taking the pro opinion on the sentence that a CT coronary angiogram can help provide adults with meaningful health data. Now, if you're a bit unsure about what a CT angiogram is, we've had a previous conversation about this in someone with chest pain. So please have a look through our episode catalogue and have a look at that. But now let me try and present to you why I think that a CTCA, which is a CT angiogram, can be helpful for someone who wants to know more about their health. So we know that a CT angiogram in most cases can show that individual what is going on with the arteries around their heart. And we've spoken previously that narrowings in these hearts can lead to angina, and that blockages all of a sudden can lead to heart attacks. And so identifying people who have these narrowings can help us understand who has got coronary disease and then implement treatments if we didn't know about that before. I understand that some people will say, hold on, what about if this person does not have symptoms? What should we do about them? But we know that there is some types of coronary disease that if you do have picked up on a CTCA, that should be investigated, because you're then at risk of more serious consequences. And so if we pick those types of proximal LAD or very high up blockages or narrowings, we should certainly investigate those further. And so it can be useful to find that. Context of symptoms, I think a CTCA has got an evidence-based role, so I'm going to not even go into that. I think there's another role where a CTCA can provide helpful data to an adult, and that is if they have got this borderline cholesterol, the cholesterol that's a little bit high, they're not sure whether they should take a statin or not. And sometimes understanding whether they've got any plaque in their arteries, whether they've got any calcium in their arteries, can be a helpful measure to inform that person who's on the fence about whether they should take statins or not. Now, in the last couple of months, we've seen some new papers come out that's saying that that level of granular data allows us to see what's really going on in someone's coronary arteries. It can help inform these decisions about risk stratification, about who needs to be on stronger doses of cholesterol medications, and so it can be useful. And of course, we've spoken previously about the Scott Hart study, where they use CT angiograms for people to investigate their chest pain symptoms. And we found that not necessarily because of the results, but because that engagement with their healthcare, it led to them being more engaged and being more compliant with medications and doing better in the long term. So there's that added bonus of people feel bought in. And I feel that if you show a patient, this is what your arteries are, these are the narrowings that you can see on this picture, this is your hard truth, that can be quite convincing for patients.
I think everything you said is correct. It can be convincing, it can be useful to risk stratify people. But I would just say that the thing that's not providing you the value here is not the CT scan, it's the interpretation of the CT scan. And you have to have someone who knows what they're talking about for you as an individual person. Because at that point, particularly if you've had a CT scan, you don't have any symptoms, right? You don't have pain. You're not even a patient yet, right? You're just a person that's had a bit of a photograph taken of the inside of their body. You need to have someone who can tell you what that means. Because if you are not in a position to understand in your own context the results of that test, it will lead to unnecessary worry, right? Potentially unnecessary medication.
Yeah.
I'm all for people taking medications to improve their health. Our entire podcast is about people not having heart attacks when they're young, particularly South Asians. And we know that there's a decade difference between the average person, the Caucasian population and the South Asian population in terms of their likelihood of having heart disease. It happens a decade early for Asians. So looking for it earlier also makes sense. But you cannot just walk off the street, get a CT scan and leave and not have the interpretation, because you will find something a significant proportion of the time, and sometimes that something is nothing, right?
Yeah.
So I see time after time people who have had these tests done It makes sense to them, and it makes sense to the people offering them the test to have it done. But now they have the results. Because the results are not the really serious thing that you said we should go looking for, and I totally agree. And also they're not perfect, because what 55-year-old man has perfect heart arteries? There's a huge amount of anxiety and worry that could be easily mitigated, easily improved by good advice before the test, right? And so what I mean by that is knowing what a positive test, by which I mean finding some thickening of the arteries, means, having a clear idea about what we're going to do about it if we see it, knowing the size of the risk that thickening provides and tells you you've got, because there's a different range of severity on these tests. And having that explained to you in a way that you can understand it, I think, is critical. And that's not the test, right? That's the person providing you the test. And then having a good strategy of medication and lifestyle interventions, as we discussed over many episodes before, to reduce this. I think there are a couple of other areas where CT scanning is useful, but perhaps a little bit overplayed. But you need to understand when people come to you and say, have a CT scan because it would change what we do about this, because there are definitely places where I would do it. We say that it kind of reclassifies or reevaluates some people's risks. So you and I might have low cholesterol, no diabetes, or we might have both of those, high blood pressures or low blood pressures. And we get into categories where we say, well, this group of people should take medications and this group of people shouldn't take medications, probably. And then you have the CT scan, and the idea is that suddenly adjudicates, because if you've got the heart disease that we're looking to prevent, then of course you should take the medications. Whereas if you don't have the heart disease that we want to prevent, then of course you shouldn't take the medications. That's quite a simplistic way of looking at it, but it gets looked at like that a lot by people, including doctors. And I find that a little bit worrying. The reason is, if you go into a scanner and what you want is average health, right? If you're just interested in average health and you come out of the scanner and you've got a result which is kind of the average, right? So if you're in your 60s and you're a man, the average is that you should have some thickening around the arteries. If you're a 25-year-old woman, you should have no thickening around the arteries. And there's a huge range in between. You want to know that your risk is kind of what everyone else's risk is, and then you want to do what everyone else does if you just want to be average. I frequently meet people who just want to be the best. They're not happy being average. They want optimum, perfect health. And that's a very different conversation. So you need to know before you go into the scanner what your personal risk appetite is. Like, I sound like a financial advisor, but what your personal willingness to take a risk is. And if you said, well, if it was average, I'd be fine, then I'd say, don't go in the scanner. It's going to be average. You're the average person. If you're saying, I want perfect health and I want to optimize every single nuance of it, then I'd probably say, okay, here are the things that we're going to do if you're going to optimize. Are you willing to do these things if the scanner shows you what it's going to show? And if you're not really willing to do those things, then don't bother having the scan. But for those people who want extremely good cardiovascular health, who are willing to take the interventions that are required, the exercise, the medications, the changes in lifestyle and diet, it can, as you say, be sometimes quite a powerful tool for motivating.
Fine. So it sounds like it's the management before and after the scan, and not just thinking about the CT scanner as an intervention in itself, right? Because you've had decades of training, PhDs in this area to be able to understand what that number means. And I guess the worry and the reason we're talking about this is because there are now services where you can just click online and book to go in to a boutique on the high street to get a CT scan done. And having a non-doctor or even a doctor who does not have all that wealth of experience can then result in those downstream over investigations, or the investigation being done when it's not needed. Yeah,
and it adds to anxiety, it adds to worry, it may lead to inappropriate medication changes. You just really need to know what you're doing with the results of a cardiac CT scan, and with the patient who has all the problems. You cannot just take the result in isolation. And that's why I worry about the proliferation of these studies, even though they are extremely valuable tools.
Yeah.
And I think probably the more people having them in general, the better, so long as we can keep up with giving them good advice and reassuring them about the results if they're mildly abnormal.
Okay, fine. So it sounds like there may be a role for people who are really at that high end of the spectrum. You were giving the con argument, but you didn't speak about the radiation. Is that because now the quality has gotten so good?
Yeah, so there is a radiation dose for every cardiac CT. And of course, cumulative radiation over your lifetime, and the earliest you have it, increases your risk of cancer down the line. And thoracic cancers, including breast cancers, are the one that we worry about the most. But a CT scan now is pretty low dose radiation, like a couple of international flights are about the same. And I'm not telling people not to go on holiday because there's a radiation dose. That's part of the conversation you have with someone before you go and have one of these scans. am I the right person to have it? What are the risks here? And so if you're someone who there's just no chance of you having coronary disease, like the likelihood of you going into that scanner and coming out with a disease is less than 1 in 10,000, then there's very little point going into the scanner, because you'll probably do yourself a small amount of damage with the radiation and you're paying zero benefit back, because you know that the scan's going to be normal before you go in, right? Whereas there are some people where you think, well, I probably would like to know, and I could make a 10% difference in their risk of heart attack or stroke over the coming decade, which would make the balance against the radiation of a cardiac CT worth that risk. And so again, that's about the conversation with the person having the test. You need to know what the benefits of the test to you are, as well as the costs, including radiation.
Fine.
And the allergies and things that go along with it. But everyone who's going for one of these tests will hear about that before they have it.
Well, I think that's important, right? So if you're listening to this because you want to maximize your health outcomes and ensure that your heart is as healthy as possible, it sounds like the first thing to do is go and speak to someone who knows about CT scans, what the value of it is, whether that's the right test for you. It may be that there are different heart scans that are better for you, or no heart scans at all. So have that conversation. And if you want to find out more, have a look at our other episode where we talk about the relationship between CT scans and then stents downstream,
Right.
because that can also be one of these unintended consequences if you go to the wrong person. It can also be the right consequence if you go to the right
Exactly.
person.
It's all about the individual circumstances. It's very hard to generalize on a podcast. But I think across that course of that conversation, I think I kind of already half believed you that everyone or most people should know about their coronary health. I think there are really effective ways of finding out without having a CT scan. I think a CT scan, you've convinced me, is a really good way of finding out, but it's always got to be in the individual case and case by case discussion, unfortunately. And the best people to talk to are people who are experts in this technology.
Great. Good. I think we'll leave it there. See you next time.